Naloxone, or more commonly known as Narcan, is a life-saving tool in the fight against opioid overdose. It is a fast-acting medication designed to quickly reverse opioid overdose. It can restore normal breathing rates when respiration has slowed, or worse, stop, if a person has overdosed on heroin, fentanyl, or prescription opioid medications. Today, we'll explore how to recognize signs of overdose, administer Narcan, the crucial steps to get help, and where to get Narcan. How to recognize an overdose. Small pinpoint pupils, unresponsiveness, not waking up or responding to stimuli, slow, irregular, shallow, or no breathing, choking or gurgling sounds, cold, blue-gray pale skin and lips, convulsions or uncontrolled movements. How to administer Narcan. Identify an opioid overdose and check for response. Attempt to wake the person. Rub your knuckles on their sternum and shake their shoulders. If no response, lay the person on their back with their head gently tilted, insert Narcan into the nasal passage, and press the plunger to release a full dose. Call 911 immediately. If still unresponsive after 2 minutes, administer second dose of Narcan. Lay the person on their side to prevent choking. Stay with the person until emergency help arrives. Even if Narcan is administered successfully, they may need additional medical attention. Narcan is now available for purchase at pharmacies, convenience stores, grocery stores, and gas stations, as well as online. You do not need a prescription and do not need to be a medical professional to use Narcan. Anyone can administer it.